Well, Anna and Jessie, thank you so much for joining me here today for the roundtable.
Thanks for having me.
It's great to
Really
have you
glad to be
both.
here. Thank you.
So Jessie, let me start with you. We are so pleased to be fellow collaborators with Healthcare for the Homeless at the St. Francis House Auxiliary Shelter. One of your case managers shared that a guest told her the meals from WLP saved their life. They said they've never felt better and they even like tofu now. Can you share from a public health perspective the value of regular access to nutritious and in our case, delicious meals?
Sure. And we're so thrilled also to be able to partner with Women's Lunch Place. The value of regular nutritious meals from a public health point of view really can't be overstated. It is like foundational to a person's health to have access to nutritious meals on a regular basis. And that's so unusual for people experiencing homelessness. I was thinking about kind of what typical nutrition looks like for people who are homeless. And even in Boston, if you're getting your meals from shelters, it's often the case that your meals are very high in carbohydrates and very high in fats. And with so many shelters, necessarily getting their food from food banks and donations, and without more resource for nutritious food, the meals that we're often serving people have very high caloric, are very high in calories and have very little nutritional value. There's very little protein, there's very little minerals and vitamins that are important for so many parts of our health. And even the portion sizes that we tend to give are often a little bit more than they should be, ironically. They're kind of larger portion sizes. I think when we're serving meals at a shelter, we often kind of heap on food because it feels good to give. And on the receiving end of that meal, if you're not sure where your next meal is coming from, you're often going to hoard food. And so there's actually a sort of ironic epidemic of obesity among homeless people. And so I guess all of that to say that I can't really overstate how important nutrition is to a person's health, and that for people experiencing homelessness without regular access to their own kitchen and enough resource to buy healthy food, I think so much of the chronic disease problems that we see elevated among homeless people, even in Boston, cancers, heart disease, diabetes, hypertension, is very related to their inability to access highly nutritious food.
Thanks. That's so important. Anna, well, your business model is obviously not driven by public health concerns. You develop beautiful, culturally centered menus. From ingredients to sourcing, how do you approach nutrition?
I think that's a great question. It's not too far off. I've always been a real stickler for a philosophy of cooking that, I think when everybody sets out to cook something delicious, the first thing they want it to be is delicious, right? That's all they really care about. Like most of all, it's got to taste good. And that's pretty easy because there's a lot of cheap tricks like Jess was talking about, like fat and sugar is a big one too, right? But I think as somebody who cooks for a lot of different kinds of people every night, I feel like there's a responsibility to do more. And the second thing you would look at when you're trying to achieve something that you're really happy with, right, besides being delicious, is how it looks. Third thing you might think about is maybe texture. You want something kind of interesting that's like crunchy and soft, or, you might look at that. But the last thing I think people think about, to be honest, when they're trying to achieve something delicious, is how they're going to feel afterwards. And that really comes down to, some of the things we try to use, like spices, and also the whole philosophy of Mediterranean cuisine, allows you to make rich food without it being heavy. So there is a lot of thought around how people will feel after they eat, but also too on the integrity of the ingredients being a real driver for us. And that to me is a big, public health thing too, is just the quality of the food that, like a homemade meal versus, something that's very, a homemade meal like the women's lunch place is getting versus something that's, off the shelf at 7-Eleven is just night and day, right? So I think in a restaurant where you're trying to achieve flavor and have people feel good after they're done eating is a fun challenge for all of us.
Yeah, I know at Women's Lunch Place, we're very proud that we're a scratch kitchen and the variety of fruits and vegetables that we use. And as you said, herbs and spices and, different cultural menus. So that's, definitely plays out. So Jessie, one intentional aspect of WLP is our restaurant style service for our meals. And our founders actually considered that avoiding lines was one way to reduce anxiety and stress, especially for women who are experiencing mental health challenges. So how does Healthcare for the Homeless approach your delivery of medical services to vulnerable women, many of whom have experienced trauma and abuse?
That's such a good question. It's a big challenge that we have. And I so appreciate the strategy that WLP uses to just improve the experience of the participants. From a healthcare point of view, the women in our practice are suffering much higher rates of a number of cancers, much higher rates of substance use disorders, and much higher rates of heart disease than people in the general population in Boston. And there's so much medical care that is really important for folks. But you're right that there are a lot of barriers that women in particular face, and some of those you've alluded to. So in terms of just approaching medical services, I guess I would say we are often needing to basically, even though we might have an agenda for what we really want to accomplish with a certain patient related to their chronic diseases or risks that they might have for things that we want to screen for, like cervical cancer and breast cancer, despite that agenda that we might have as medical providers, we know that the women who are coming into care with us have typically an acute need that is most important to them. And one strategy that we employ just to improve engagement with people is to try to address those acute needs that someone has. It's often a wound that they have that they need taken care of, or something that's very pressing to them, that we know we need to address that first. We need to sort of get that taken care of before we can then have conversations about screening and doing preventive care, or conversations about treating a chronic disease that may not bother them moment to moment, like hypertension, that we know is so important in terms of risk for heart disease. And yet it's not something that is feels pressing to them, especially since they're struggling to meet basic survival needs. Those are always going to trump, issues that might happen way down in the future. So I think working with programs like Women's Lunch Place that helps to meet the basic survival needs of food, for example, really helps us then go a little bit deeper in terms of preventative care and chronic disease management.
That's great. I mean, that's why I think our partnership is so valuable, so that we can balance out those needs for our guests. So Anna, our staff and volunteers, you've been in our kitchen, you've seen this. We carefully plate our meals, we dress them with herbs, and we wipe stray sauce from the plate. And with the pandemic, we had to suspend our community meals, and we had to ship to takeout containers and curbside service. It felt very unnatural. So how did you balance the need to modify that hospitality aspect of your service with public safety guidelines and obviously concerns for your clientele?
Yeah, I think, wow, yeah. That was an odd feeling in the beginning, but I feel like very quickly we began to find footing and purpose, and it wasn't what we knew, but then, so the pandemic wasn't what we knew either. So, I think I remember, really deeply questioning myself, are we essential? Do we, should we be putting ourselves at risk? Because, at a women's lunch place, there's no question, if you guys stopped, there would have been, people could have died from starvation. I mean, but for us, it was more like, trying to feel as though we were essential, doing something completely different from what we're used to, like just relying on a lot of takeout in the beginning, and also just going through the process of learning new systems too. But it very quickly became apparent that there was a need, just people that were really busy with families with kids at home, and not a lot of time or energy left to cook, quite frankly, or just feeling a little down and needing some assistance or a pick me up. And so, yeah, very quickly we found a way to really find purpose and really feel essential, during this whole thing. And did we, we definitely got used to putting things in boxes, and actually sometimes it looks kind of cool, and you know what I mean, but it's not, I certainly can't wait till we can all sit around a table again and not worry when we take our masks off, etc. But yeah, it was pivoting. It was some very deep, thoughtful questions, but yeah, I think, feeding people is essential for sure.
Absolutely. Well, thank you. Jessie, we all know that this pandemic has been challenging and unpredictable. And at Women's Lunch Place, I know we're just really proud that we were able to keep all our core services running and serving our guests. What's the emotional toll, though, of this unpredictability on our guests? And then conversely, what's the value of a safe, stable community in supporting positive health outcomes, for women who are experiencing homelessness?
Those are such good questions. And thinking about the emotional toll of the unpredictability of the last year, and how that has maybe been magnified for women who don't have stable housing. I was thinking about the fact that, isolation has been such an important part of the public health response to preventing COVID, and yet for people without homes or in crowded homes, it's really impossible to isolate. And so I think that probably the emotion that I've witnessed the most among our patients is just a severe anxiety around being able to prevent themselves from getting sick, or if they do get sick, of getting the care that they need. So the emotional toll of just a fear and anxiety about infection when you're necessarily in more crowded spaces of shelters or street life, or more crowded housing, has been probably front and center for people. But there's so many other emotions. I think people are feeling less connected to their support systems. And if your support system is, in part, social service agencies or medical providers who are helping you navigate things, and you can't see them in person as often, especially if you don't have reliable access to a phone or the internet, which so many of our patients don't, then the isolation, I think, takes another type of very deep emotional toll. And it's magnified really for people that don't have safe and stable housing. You asked conversely about the value of community right now, and it's just so important. I think it might be the most important thing. I mean, community really at its essence is connection to other human beings, and at a time where you're scared and sad, like, connection to other human beings and community is there's nothing more important than that. So I think it's just critical. And I'm thinking about the type of community that is provided at WLP. It's a place not only where you can experience community, but it's in such a dignified way. and such a respectful way. And so, whereas, so many of the services that the clients and participants might be getting elsewhere are important, they're not always quite as dignified and respectful, and also unique for women. And so I just think that there's such a special void that your program is filling. But community is the most important thing right now.
It's so true. And I know for our staff, connecting our guests to technology was really important during this time, and just increasing our outreach. So it is, you can build community in different ways if you have to, but it's vital. You're right. As I sort of reflect back on March 2020, I honestly and truly did not know how and if WLP would make its way forward. There was just so much uncertainty. And I'm incredibly grateful for our creative and resilient staff and all the pivots they made and creative ways that they approached our work. And I'm also grateful for the generosity of our volunteers, our donors, our guests, and our collaborators across the city. And they've really allowed us to survive and thrive. So can each of you share, if and how you've experienced one of those silver linings of a pandemic, and what that was? Maybe Anna first.
Yeah, I just think a lot more time to reflect deeply, and a lot more time to appreciate the small things like, where the food is coming from. And I think that was and the planet and things that, we've been sort of, really forced to come to a screeching halt and look closely at everything we were doing, and everything about our choices. And I think a lot of really great things for our businesses. Lots of silver linings, for the hospitality industry and the restaurant industry going forward. Less of a gap between the service staff and the kitchen staff in wages, and a much more sense of oneness in a restaurant and teamwork.
Jessie?
I had a long list of silver linings, so I'm trying to think about how to narrow it down. Just the sharp focus on inequities that we've seen with COVID infection and deaths among people of color all over the globe, really, but in Boston and in Massachusetts. I think that's a silver lining in terms of just really bringing inequities, racial and ethnic inequities, to the forefront, which was predictable, and it was really clear that was going to happen. But I think bringing that into sharp focus has helped us look at so much else in our public health infrastructure and healthcare infrastructure from an equity lens, and that's a major silver lining.
Yeah, I agree. That's such an important basis of our work at Women's Lunch Place, and we do feel like there's more community voice and focus on that more than ever. So, well, thank you both so much for joining me. I think it's the best conversation I've had on food and community in a long time. And I know we've been through a lot, but we have a lot to be hopeful for. So thank you for joining us today.
Thank you so much.
Great to be with you.